All right, so hello everyone. Good morning to all our participants, now 100 participants joining us via Zoom, and also to our participants joining us via Facebook Live. Magandang umaga po sa ating lahat. Naimbag nga bigat kada kayo amin and masantos ya kawasan at si namin. No, so welcome to our third learning session for the celebration of the National Mental Health Week. So for those participants who are or who have been with us since day one, thank you so much, our dear students, PSU-Lingayens, also to the faculty members who are joining us also. Now, despite of holding these sessions online, okay, you are still with us, so much willing to learn. Okay, so today, okay. But before that pala, no, I forgot to introduce myself. I am Ma'am Donna Gavina, the guidance counselor of PSU Santa Maria campus. Okay, so I am very much honored to be part of this celebration. Thank you so much, Ma'am Beverly Fernandez of Lingayen campus, okay, for giving giving us this opportunity to be part of this learning session. So for today, I want to talk about something very important in terms of addressing our basic human needs. Of course, as equally important with those um, topics which were discussed by our two colleagues, Ma'am Beverly and Ma'am Sheridan. No? They have shared something about self-care, and also Ma'am Sheridan have shared to you something about wellness check-in. So, you have to always remember that um, it is always our goal. No? It is always included in our mission as being part of the university, Pangasinan State University, no po, to ensure that all our students, okay, including the employees of PSU, every PSU union, no, is doing fine and doing great. Okay, so it is always our end goal in providing you this kind of webinar series. The very reason why we are doing this is always to promote and acknowledge that mental health is a vital part of our overall wellness. No? And of course, to encourage everyone to become a mental health advocate, just like me, just like Mom Beverly and Mom Sheridan is or are. Okay, so especially in these trying times, there are a lot of people who needs us, who needs you. Okay, so um, there. I wanted to talk about, or I wanted to start, my discussion about this basic question. Kamusta ka? Okay? Kamusta ka ngayon? Kamusta po kayo ngayon? Okay. How are you doing today? Are you feeling okay? Or are you doing great? Okay. Or are you feeling or not okay? Okay, so to help you answer that question, okay, maybe I could ask you to identify your current emotion through the colors presented to you in the screen. Okay, so we have here 4 colors which may represent your emotions. So if you have a low energy today, you have a low motivation to participate, that is represented with blue color. Okay, so if you are feeling attentive, if you are feeling positive right now overall, that's green. And if you are uncomfortable and needs to focus, that's yellow. And lastly, if you are feeling full of if you have a full of negative emotions, no, and um, that you could use pink. Okay, so you may answer the question kanina, kamusta ka? Kamusta ka right now? How are you feeling today? Okay, using these colors. Okay, or by commenting in our comment box na these colors. Okay. So I believe meron po tayong mga colorful emoticons. So marami tayong iba't ibang icons dyan sa ating phones and also to our laptops. Now we have also. So you may use those as icons with of course the same colors no, na nasa screen ninyo. Okay, to represent your current emotions right now. Okay, so let's wait for your answers. Okay, so for example, you are feeling positive right now, no? You have that energy, no? So you may comment down green hearts, no, in the comment section. Okay, so ayan, you may comment them now because, okay, those, nakikita natin yan. Those participants who are joining us via Zoom, yan, nakikita po natin yung mga comments ninyo. And also to our participants joining us via Facebook Live, you could also use our comment section for your answers. Okay. I believe, no, we are still experiencing a strange crisis right now. No, we are still having a very challenging situation because of ayan nga, the COVID-19 pandemic. Don't you agree? Okay, so a lot of you um are still frustrated, no, about the things that is happening right now. So, but our question is, how are you today? So we are basing our question, or we will be basing our answers to our present emotion. Okay, so ayan, may nakikita na ako mga sagot. Thank you so much. Okay, may mga green hearts. Okay, yan. Also blue, may mga ilang blue. Okay, so what is the reason, no, behind this activity? Okay, so in this activity, I wanted you to realize, no, or the reason why I introduce you, no, this activity is for you to realize that what you are feeling today, okay, are perfectly normal. No, those are normal reactions as of this time. Okay, so our reactions, no, to the everyday challenges, no, brought about by the pandemic, okay, or this is a normal reaction for any stressful event, okay, or disaster, okay. So all of those emotions, no, are normal and valid. As you can see, maraming mga estudyante na nararamdaman din yung nararamdaman nyo. Nakikita nyo naman na may mga kapareho kayong may emotions na positive, okay? May emotions na low energy din or are having low motivation right now. So I wanted you to realize, no, that it's fine. It's okay not to feel okay. So ayun, you know, it's perfectly normal, no, to feel a very wide range of emotions, no? To feel confused, to feel out of control, no, to be frustrated of what is happening in our world right now. Now, all of this stuff makes sense given the situation we are in. Okay, so ayun, no, 'di ba? The need for community quarantine, no, the need for physical distancing, 'di ba, have resulted to dramatic changes in the lives of our learners. And also, of course, to us, our teachers. No, it triggers a lot, no, all manifestations of stress. So, hindi lang kayo yung nakakaramdam ng ganyan. So, that's perfectly normal given our situation right now. Okay, so amidst all this, it's therefore very important na po, as well as It's very important that we know how to handle, no, and maintain not only our mental health but also the mental health of other people. So let's now proceed to our topic. Okay, I know um you are having a lot of information overload since the first week of classes, no? But I hope you could still answer this pre-test questions. Okay? It's a very brief, very short lang naman na pre-test kasi apat lang na question. Okay, so you may opt to grab any pen and paper with you. Okay, so sagutin natin itong true or false questions na nasa screen natin ngayon. Okay, so you just answer there muna sa inyong paper. Letter T or true, sige, the word true if you think the situation or the statement, okay, is correct, and false if the statement is incorrect. Okay, so for letter A, is it true or false? Psychological first aid is done by professionals. Letter B, okay, psychological first aid is the same with counseling, with therapy, and with debriefing. Is it true or false? Okay, so and letter C, it is about treating or curing a mental health condition. Psychological first aid is all about treating or curing a mental health condition. Is it true or false? And letter D, it is about encouraging a person to tell you about a detailed story of what has happened to them to help them cope with it. Again, PFA is about encouraging a person to tell you about a detailed story of what has happened to them to help them cope with it. Okay, so true or false? All right, so we are going to see if your answers are correct or incorrect later as we go through our discussions. Okay, so, but then again, may I ask everybody to comment down their answers in the chat box, okay, or in our comment section so that others could see also the inputs of everybody, okay, or the answers rather of everybody. All right, so thank you for your participation. So let's now proceed to our topic. So, okay, so I know most of us are very familiar, no, with medical first aid. So, pag sinabi nating medical first aid, ito yung paunang lunas na binibigay natin sa mga taong nangangailangan, no, during accidents, for example, 'di ba? It's very imperative that people around will provide basic medical care to somebody experiencing a sudden injury, no, experiencing sickness, ayan. So we call it medical first aid. So first aid refers to the emergency or immediate care people should provide, no, when a person is injured, okay, or ill, no, until full medical treatment is available. So, diba, we have to make sure that a person is breathing, no? Remember the ABC, no, sa mga nag-training dyan ng medical first aid. Okay, so, diba, unang-una na dapat nating tandaan or dapat nating i-check is the airway, no? And then letter B, breathing, no? Letter C, cardio pulmonary resuscitation or CPA na tinatawag natin. So, pag merong emergency ganyan, we have to stop any major bleeding first. Okay? And get the person an ambulance. No? that is all about giving a person a medical first aid. Okay, so but the question now is, okay, what about, sorry, okay, so the question now is, I'm sorry, bumabalik yung ano natin. The question now is, what about the psychological damage, no, ayan, that the accident have caused, okay? O, sige, sabihin na natin successful yung medical first aid na yan. Okay, nagawa mo, naligtas mo siya. Okay, naligtas mo yung buhay niya. So what about the possible long-term effect, no? That um, that particular traumatic experience have caused to the person. Okay. Anong gagawin natin dyan? Okay, so how do you help, no, somebody who is going through a psychological distress or maybe experiencing loss or grief, diba, after a traumatic experience, which have of course caused by an accident or a disaster or maybe a death of loved ones, especially in this pandemic, diba? We are losing a lot of our loved ones. Okay, so what about that psychological damage? Okay, so in this situation, okay, it is where, right, it is when psychological first aid is so much needed. Okay, so you know, first aid for our minds, okay, is just as important as first aid for our body. Okay, so just like medical first aid, no, learning psychological first aid skills or mental health for mental health crisis could also save a life. So what now is psychological first aid? Ano bang ibig sabihin ng psychological first aid? So we will be answering this with the basic 5 WH questions. Okay, so first, what? Okay. Ano ba ang PFA na tinatawag natin? So, psychological first aid is a humane, no, supportive and practical assistance to help other people feel safer. Ayan, to help them have a more connected support system during times when people are feeling overwhelmingly, ayan, stressed, worried, anxious, or fearful. So these feelings are usually brought about by situations, kaya sinabi ko kanina, such as natural or man-made disasters, for example, earthquakes, diba? Floods, fire, even yung mga nangyayari before, volcanic eruptions, no, even war, 'di ba? Meron tayong mga pinapadalang volunteers for psychological first aid kapag ganyan yung mga nangyayari. Even pandemics, no, yung mga nangyayari ngayon, sobrang kailangan ng mga volunteers who knows how to perform psychological first aid. Even during emergency situations, medical emergencies, for example. So it is about establishing a connection with people in distress, no, in a compassionate, non-judgmental manner to bring calm and comfort. So basically, PFA is about comforting somebody, no, who is in distress and helping them feel safe and calm. Okay, so, but, okay, participants, we have to remember, no, that PFA is never or is not a treatment or a cure, no, for a certain distress. No? But just like medical first aid, kaya nga tinawag po siyang first aid because it is designed to help people become stable or become stabilized. Okay, so I hope we are clear on that. So next, what PFA is not. Okay, so here are some common misconceptions now about PFA. So PFA is not something only professionals can do. Okay, so you don't have to be an expert, or you don't have to be a professional psychologist or professional guidance counselor to provide PFA. Okay? You could be a student. Okay? You could be a teacher. You could be a parent. No? Anybody. You could be anybody. As long as you are ready, okay? As long as you have the skills, you are stable, you have a stable state of mind, of course, no? You have the heart, that's very important. That's why we are doing this session, to encourage everybody to be one of us, no? Parang nagre-recruit lang sa organization, no? So, ayan. So, PFA can be provided by anybody as long as you are ready. Okay, so number two, PFA is not the same, okay, as counseling, as therapy, or psychological debriefing. So bakit? No? Pareho lang naman na, 'di ba, yung end goal natin dito is to help a person regain his state or stable state and healthy mind. Okay? So, di ba pareho lang yun sa counseling? Pareho lang yun sa psychological debriefing? Pareho lang po yun sa therapy, di ba? Okay, but, remember, okay, that these three, okay, yung tinatawag nating counseling, tinatawag nating therapy, and debriefing, no, can only be practiced by professionals. Okay, counseling can be, for example, can only be done by RGCs or registered guidance counselors or counseling psychologists. Not therapy, debriefing can only be done by professional psychologists. So it cannot be done by anybody, without any license at all. Okay, therefore cannot be done by PFA providers only. Okay? So, I remember dun sa una nating sinabi kanina, PFA can be done by anybody. Okay? But sa counseling, therapy, and psychological debriefing cannot be done by anybody lang. Okay? So, ayan. Okay, so next, ayan, it's not about asking someone, no, to analyze what has happened to them. Please do not ask the person, no, who are experiencing distress, lalo na kapag traumatized yung tao, no? Please do not ask the person to tell you detailed, no, discussion of the event which have caused the distress. Okay, so number four, it's not about pressuring people to share their feelings, okay, and reactions from this stressful event. Okay, so in fact, no, our dear participants, forcing people to debrief or to talk about the things that have happened to them, to talk about everything, no, na nangyari sa kanya, might actually hurt them even more. Okay, so mas masakit kapag ikikwento niya yun ulit sa'yo by detailed. Okay. So, next WH question is who? Okay. Who is psychological first aid for? Okay, so it is for any distressed person, okay, who may be, it is for any distressed person who may be experiencing sudden loss or grief after a traumatic experience. Sudden loss can be very hurtful. Okay, why? Because it occurs without any warning at all. Sudden nga, di ba? It leaves no opportunity to prepare. So, masakit kasi biglaan, no? Remember that loss comes in many forms. It may be from a death of a family member, a death of a friend, okay, or death of a pet, even, or a loss of a home, okay, because of fire or loss of a home because of flash floods, lalo na ngayon, no, katatapos lang ng napakalakas ng bagyong Maring. Many of our kababayans in the north, no, have lost their homes. So, ayan, napakaraming nangangailangan ngayon ng psychological first aid. Okay? Loss of job, loss of way of life even. No? Especially right now, in this time of pandemic, we are losing our old way of life. Diba? Most of us are experiencing this stress because they are not used to the kind of lifestyle which is brought about by the new normal. So there are a lot of reasons to be distressed in this time. Okay, so let's go to the next W question. Okay, we have here two questions, when and where. When is the right time to provide PFA? Okay, and where to conduct PFA. So let's start with the when. So kailan ba yung right time to provide PFA? Okay, so it is when someone is in distress, okay, before, during, or immediately right after, no, a crisis event or a stressful situation or a traumatic experience. Okay, it could be emergency or non-emergency. No, pwedeng emergency siya. Okay, pwede rin namang non-emergency yan, nagka-problema yung friend mo or namatayan siya. Okay, kailangan ng PFA. Okay, it could be a personal or larger crisis. Yung example natin kanina, personal yun. Okay, personal problems, break up, for example. Yan, no? Or larger crisis. Kagaya ng nakikita nyo mostly dyan sa screen ninyo, no? During earthquakes, flash floods, okay? Pag nasunugan ng bahay, no? Mostly natotraumatize tayo, lalo mga bata, no? So, kailangan ng psychological first aid ng mga yan. Okay, so next, where? No, saan ba kinakonduct ang PFA? So, PFA is designed for delivery in diverse settings. So, in shelters, for example, in hospitals, yan. In medical triage, no? Kapag nasa or even in the emergency room, okay, or outside the emergency room, sometimes, di ba, pag merong nangyaring emergency situation, may na-aksidente, of course, yung taong na-aksidente nasa emergency room. Okay, sino yung natotraumatize? Hindi lang yung nasa emergency room, but also the people who the people who have witnessed, no, yung nangyaring aksidente, no? So makikita mo nasa labas yung mga yan ng emergency room, tuliro, 'di ba? Or nakatulala. Okay, so you could conduct PFA there outside the emergency room. But always remember, okay, you have to make sure it is safe. Okay, you have to make sure also it is safe, and of course yung privacy ninyong dalawa is very important, especially if your client or if the person requested this. Okay, so ayan, pwede ring sa mga war zones, nangyayari rin yan, no? Nagkakonduct din tayo ng PFA right after war, no? Yung tinatawag nating ground zero, yung previous na nangyari years ago, na marami tayong volunteers na nagpunta doon, no, to conduct PFA. So, ayan po. Even at home, pwede. At work, may nakita kang workmate mo na merong pinagdaraanan. At school, may estudyante ka, may classmate kang nakita mo, nasa sulok lang. Okay, so yan. Maybe they need PFA. Okay, so next question. How? Okay, so I believe this is the last, no, in the 5 WH questions. So how? No, how is PFA done? How to perform PFA? Okay, so Most of the time, we do it, ayan, face-to-face. But because of our present situation, no, keeping distance from others is required. No. But you know, students, physical distance can still be bridged by keeping socially connected with others. So even if you are distant, no, magkalayo kayo physically, you can still bridge your communication through keeping yourself socially connected with other people. So other options, okay, might be ayan, remote PFA. So how could that be possible? Paano natin gagawin yan? Okay, so through the following modes of communication, so meron tayo dyan SMS, text messaging, you could done it through phone call, video calls, yan, social media, applications, and other platforms. Okay, so there. So the question now is, are you now ready? Okay, since you are now familiar with the answers in the 5WH questions in PFA, here's the next question. Are you now ready to become a PFA provider? Okay, yes or no? Ayan. So before providing PFA, okay, we have to make sure first that we are stable. Okay, that is why, okay, I am presenting you this self-care plan. Actually, self-care plan was already presented to you during our first learning session by Ma'am Beverly Fernandez. No, na-discuss niya na sa inyo about self-love. No, how are you going to love and take care of yourself? So, bakit natin to ginagawa? No, you know, self-care is a essential component to supporting others. And sabi nga natin, 'di ba? You cannot give what you don't have. No, you know, it's very difficult to support somebody, to give care to somebody or to someone else if you don't know how to take care of yourself. Hindi mo nga maalagaan yung sarili mo. Paano mo maalagaan yung ibang tao? Hindi mo nga kayang mahalin yung sarili mo. No, paano ka magbibigay ng love sa ibang tao? So it's very important that understanding and taking care it's very important to know, no, that understanding taking care of yourself is a critical part of providing PFA. So, sabi ko dyan, self-care, ayan, is an essential component to supporting others. So, ayan, you take time, no, to love yourself, take time to take care of yourself, because only then will you have so much more to offer others, yung sinabi ko dyan. So remember that our role as a PFA provider later on is to guide. Diba? So how can you guide? How can you help the person manage herself? Or how can you guide the person in the process of self-reflection if you yourself hindi mo kaya? Okay, so ayan. Your self-care plan will help you, or that is the thing that you will be using to manage your stress, your own stress, to maintain your physical, mental, and emotional health. Okay. But then again, self-care plan is something that you should be revisiting regularly. So araw-araw yan, check mo dapat ang sarili mo. If you are stable, if you are okay, so yan. So if you think you are ready, no? If you think you are ready to provide PFA, prepare to do the following actions. So we have here the PFA action principles. So PFA is guided by these 3 major core action. Okay, so kapag ready ka na, you also have to prepare to look, listen, and link. So tatlo po yan na dapat nating tandaan. Tatlong LLL, to look, to listen, and link. Right? So let's look at the first action principle, to look. Okay? So dito, we have to pay attention to a situation. Okay, so dito, ginagawa natin yung checking, no? Or looking for information, okay, on what is happening around. Okay, or you need to be updated about what has happened. For example, yung halimbawa natin kanina during a disaster, for example, bago ka sumabak, you have to look first, no? What happened? Anong nangyari? You have to be updated muna kung ano ba yung situation, no? Ano ba yung nangyari dito sa lugar na to, no? Aside from assessing the current situation, you have to assess also what are the risks. Okay? Okay na ba? Nalapitan mo yung mga tao? Risky pa ba? Okay? Kahit sa personal problem na sinasabi ko kanina, no? You have to assess first, is it okay to approach the person? Okay? Safe na ba? Wala na bang risky situation? So, ayan. And also, you check who are the ones affected. Ayun nga, sa disaster, you have to check muna who are the ones na kailangan kaagad ng PFA. So, ayan. And then, you also check what are the feelings of people around. Okay, what are the feelings that they may have had. Okay, so that is the thing that you should look for. No? We must learn to look between the lines for signs of stress, for signs of distress, and anxiety. Okay, so in here we could see, okay, so here are the following common reactions to stressful events. So we have four aspects, no? We have emotional reactions, behavioral reactions, physical reactions, and ayan, mental reactions. So for emotional reactions, yan, sino ba yung feeling sad, no? Yung umiiyak siya, okay? Even being angry, galit, no? Scared, etc. You know, our brain, no, the brain of a human being has that natural rapid detection of expressions of anger and fear. No, we have that special skill, no, to detect yung mga negative emotions ng tao. That is because, di ba, we are animals, no? We have that survival instinct. So, mas mabilis na nadidetect ng brain natin yung negative feelings kesa sa neutral or positive feelings. That is because of our survival instinct. So, kapag merong crowd, no, merong isa na nagdi-display ng fear or nagdi-display ng negative feelings, sadness, okay, yun yung unang mong makikita. Yun yung unang madedetect ng brain natin. Okay, so because of survival instinct. Next is behavioral reaction. So ano-ano tong mga to? Shaking, no? If you see somebody is trembling, okay, there's something wrong. Okay, headaches, pains, difficulty sleeping, lack of appetite, and etc. So the next, physical reactions. I'm sorry, that is physical reactions pala, no? And the next one is behavioral reactions. Okay, so ito yung mga, if the person is becoming violent, no? Silence even, yung kabaliktaran naman. No? Kung tinitignan natin yung violent, tignan din natin sino ba yung silent, yung hindi umiimek. Okay? Sometimes being silent, no, needs much more attention and much more help. Okay? So, ayan, lack of motivation, those who are avoiding doing activities, ayan, there must be something wrong. Okay? Mental reactions like common reactions to stress, mentally are loss of concentration, memory loss, no, confusion, intrusive thoughts, difficulties in decision making. Okay, disorganized thought, no, kapag disoriented yung tao, not just like, for example, not knowing his name. Okay, hindi niya alam saan siya galing, ano yung nangyari. Ayan, there must be something wrong. So those are the common reactions. When you say common, it's typical. It's normally, people will react this way when they are faced with certain stressful events. So ito mga bagay na to pala ay normal. No? These are observable signs and might be easy to determine when you see it firsthand. No? So, but how do we do it when we are not with them? No? In our situation right now, how can we do it remotely? Okay, paano natin madidetect yung mga signs of stress and anxiety online? Okay, so again, pay attention to the situations. Okay, observable signs. Okay, so ayan, we could detect signs of stress and anxiety through their social media posts. Yung mga Facebook statuses nila, Instagram posts, yung mga pictures, photos na sinishare nila, no? Yung mga, ayan, nilalagay nila sa stories nila. Okay? Or if they are no longer responding to your calls, okay, bakit anong nangyari? Dati lagi ko tong kachat ha. Bakit ngayon parang hindi na siya sumasagot sa messages, no? Wala na siyang paramdam or etc. Okay? Or if they are low in productivity, for example, teacher ka, yung estudyante mo, bakit parang he doesn't attend to our online class anymore, no? Their outputs are very poor, no? Or sometimes hindi na sila nagsasubmit ng learning activities. There must be something wrong. So these are signs and signs of anxiety and stress. Okay, so and sabi ko nga kanina, these are common. Yung mga kaninang nabanggit natin, common or typical reactions of people right after or if they are experiencing stress. But aside from that, you also have to know to identify this red flags. So ano yung tinatawag nating red flags? Warning na hindi na lang PFA yung kailangan ng mga to. Okay? Severe and long-lasting distress. Okay? People with serious or severe or life-threatening situation might already need other forms of intervention aside from PFA. Okay, they might need emergency medical care, no? So hindi na sapat yung PFA. So again, number 2, if they are already engaging in harm, self-harm, okay, they are inflicting harm to themselves already. Ayan, not only to themselves, yan yung pangatlo, aggressive behaviors. They are already becoming destructive. No? These are people who are upset. No? And people who are upset can no longer care for themselves and can no longer take care of their children, of their siblings. Ayan. So, threat of or threat pala. Threat of harm, no, to self or other people are red flags already. So look for the signs that persons may hurt themselves or others. Yung mga lalabas ng suicidal notes, no? If they are already showing signs of suicidal thoughts. Ayan. For example, ayun, yung mga bagay na yon, if so, you already have a legal obligation to seek immediate support. Okay? Para sa kanila. Okay? Support from the police, for example, security team, assistance from psychologists, yung mga yan, medical practitioners, ayan. And lastly, if the person can no longer function, okay, normally. For example, if an individual is showing signs of shock, no? Yung example natin kanina during disasters, usually people are already showing signs of shock, no? Ano yung mga signs na yan? Pag medyo pale na sila, clammy skin, they are already very weak, no? Rapid pulse rate, becoming dizzy, ayan, may irregular breathing, ayan, yung mga yan bagay na yan, okay? So those are signs of shock which needs or immediate medical support already. So, wag mo nang bigyan ng PFA, no? Dalhin mo na kaagad sa medical support. Right? So, the next one, number 2, is to listen. Okay? So, to listen is to pay attention to the person. So, after paying attention to the situation, nakita mo na yung sitwasyon, okay? Na-assess mo na kung ano ba yung nangyari, nakita mo na sino ba yung nangangailangan ng support. Now, you now approach that person. Okay? Pay attention to the person. Okay? But remember, when we say listening, okay, sabi ko dyan, it is much more than hearing. So, because listening includes the right attitude, the right behavior of a person. So, listening actively occurs when you make that conscious effort, not just to hear the words, but to understand the complete message, no? Being communicated to you. The complete message is communicated through hindi lang yung sinasabi, but also through the body language of the person, the facial expression, the inflection or the tone of voice, no? Kung paano kanya kausapin, paano siya mag-share sa'yo. Okay? In addition to the words that are being said. Okay? So, first, una nating gagawin in the process of listening, you initiate interaction. You make contact, no? So, paano natin yan gagawin? You approach respectfully, okay, the person. You introduce yourself, na po. Of course, before doing that, you have to make sure that you are calm. Ayan, be calm. Kita niyo yung arrow na pupunta sa initiate interaction, dapat bago ka mag-initiate ng interaction, bago mo i-approach yung person, no, you have to make sure na kalmado ka. Okay? When you are approaching someone, okay, hindi tayo pwedeng lumapit sa kanya na ikaw mismo na stress ka rin. No? Ikaw mismo hindi ka pa ready. Okay? Huwag mo siyang lapitan kung hindi mo alam yung sasabihin mo. Huwag mo siyang lapitan, no, kung hindi ka kalmado, kasi baka mamaya instead that you help the person, baka mamaya you will make the situation worse. Okay? So, ayan, if that's the case, you might not be ready about PFA. So again, balik ka muna dun sa tinakol natin kanina about self-care. Sa tinakol ni Ma'am Beverly last Wednesday about self-care. No, you have to make sure you're fine, you're okay, and you're stable. Okay, so next, number 2, okay, after approaching the person, no, you ask if you can provide help. Okay, so although sometimes it's very obvious na rin, no, that the person needs help, kaya nga mo siya nilapitan. But it's very important that you still ask the person kung pwede mo siyang tulungan or kung gusto niya na tulungan mo siya. You ask the permission of the person first. Okay, kahit na obvious na yung sitwasyon. Okay, wag kang basta-basta, okay, halika rito, tutulungan kita. Hindi ganon. Okay, you have to ask, kailangan mo ba ng tulong? Okay. So, ayan. Because asking first is again an act of respect and being courteous. Okay? So, of course, before doing that, bago mo gawin yon, bago mo siya i-ask, you have to make sure first that you are ready and you are open. So, be open. So, when asking a person if you can help, be open to listen. Okay, so make sure pag tinanong mo siya kung kailangan ba niya ng kausap, make sure you are 100% or more than 100% willing to listen. Dapat ikaw yung tao na good listener. Marunong kang or you are patient enough to listen kahit na anong ikwento niya sa'yo, kahit na anong sabihin niya sa'yo, or kahit na anong tulong yung hingiin niya sa'yo. Because you ask for it. Okay? So next, number 3. Ayan. If sinabi niyang no, okay, hindi ko kailangan ng tulong, ayoko ng tulong, okay, may mga times na ganyan, may mga instances na ganyan po, no? Do not pressure them to talk. Kapag yun yung sinabi niya sa'yo, okay, sige. Okay? Lumayo ka muna. Okay? Or, sige, lalayo ka but you have to stay close to the person. Okay? Or sometimes kasi gusto nilang mapag-isa, no? May mga taong ganyan. Sige, ayoko muna, gusto ko mapag-isa. Okay? Sige, lumayo ka but you always keep an eye on him. Okay? Make sure that you could still see the person, no? Kahit sinabi niyang ayaw niya ng kausap, dapat i-check mo pa rin siya. Okay? May mga ganyan kasing tao, ayaw ng kausap. Okay? May mga instances na na-experience natin yan, no? Tinatanong natin yung taong may problema, kailangan mo ba ng kausap? Gusto mo, dito lang ako? Okay? May mga taong nagsabi, ayoko, gusto ko mapag-isa. Okay? Hindi kita kailangan. Okay? May mga iba, o sige, sabi mo ganyan, o sige, ayaw mo ng kausap sige, alis na ako. Huwag ganun. Okay, if you are really caring for that person, do not leave the person. Okay, magdistansya ka lang, but make sure he will not be left alone. Lalo na the person is experiencing something that is very challenging, no? So hindi siya pwedeng maiwan mag-isa. Okay, so ayan. Next is, if pag sinabi naman niya, yes, I need help. Okay? So, sige, tulungan mo. You find a safe and quiet place, no? You help the person first to feel calm and comfortable. Pwede mo siyang bigyan ng tubig. Yan, 'di ba? Ganun yung ginagawa natin pag may mga nangyari, nasunugan yung tao, na kalalabas niya sa sunog, na-traumatized pa siya. Bigyan mo ng tubig. Or maybe you could give the person a blanket. Ayan, so that the person will feel comfortable and calm, no? And then feel safe. Okay? Then after that, you ask them about their needs. No, of course, this is to determine, no, what kind of support they need. Okay. So I have here, I guess an example in the next slide. So yan, ito yung pwede nating gamitin, no, or pwede nating example ng pwede nating sabihin dun sa tao. Okay, so pwede mong sabihin, hello, my name is Ma'am Donna. Okay, or my name is Don. Huwag mo na lang palang sabihin ma'am. So para hindi naman siya ma-feel intimidated, no? Sabihin niya, ay, ma'am, ito. Okay, so yan. So sabihin mo na lang, hello, my name is Donna. So I work with this organization, or I'm working with Pangasinan State University. So we are checking in with people to see how they are doing. Now we are checking to see if we can help in any way. So is it okay if I talk to you for a few minutes? So if yes, sinabi niya, so you may ask for the name of the person. So may I ask for your name? So pag sinabi niya, for example, ako po si Jana. Yan. So, okay, Jana, before we talk, is there something right now that you need, like water or like hanky? So yan, para ma-feel niya naman na talagang concerned ka sa kanya at safe siya sa'yo. Okay, so yan, pwede nating umpisahan sa ganyan. Okay, yan, try nyo rin sa inyo yung yan, i-save nyo ito. Then, i-try nyo, i-practice nyo na i-practice kung paano siya sabihin na maganda at maayos para ma-feel safe yung tao. Okay, so, there. So, in listening, no, we need to ensure also, ito pala, in case disoriented, no, kasi may mga times na disoriented yung tao, no po, so, help the person make contact with themselves first. Okay, so paano po natin yan gagawin? Okay, pwede nating itap yung lap niya, of course with with respect, or make sure first na okay dun sa tao na itap mo yung legs niya, or tignan mo muna kung babae yan tapos lalaki ka. You have to be sensitive enough, no? That next, help the person to make contact with their surroundings. So by noticing things around them, sabihin mo, okay, so nandito tayo sa okay, nandito tayo sa isang lugar na kung saan, ganyan, okay. Okay, nandyan si mama, papa mo, okay, sila ay ginagamot lang, okay, ng mga medical providers natin or medical practitioners natin, andyan lang sila, okay, hindi ka nila iniwan, okay, so ayan, okay, or help the person make contact with their breath. So, paano mo na gagawin yon? Okay, so help mo siya, i-lead mo siya in some breathing practices. Okay, so, yan, breathe slowly, tulungan mo siya, magbilang ka, ayan, sabayan mo siya, ayan, sa pag-breathe, para makita rin niya kung paano gagawin yung bagay na yon. So, ayun po. Okay, so here are some principles in active listening. So, in listening, we need to ensure we carry out this following principles. So, number 1, be present and available. So, of course, it's very important na nilapitan mo siya, you have to be present and available. Huwag naman yung nilapitan mo yung tao. For example, maraming in a war zone. For example, ganyan, maraming kailangan ng tulong. Nilapitan mo yung taong yun. You have to be present for that person and available for that person. Huwag naman yung nilapitan mo yung tao, tapos mamaya nagkikwento siya sa'yo, tas ikaw na PFA provider, tumitingin-tingin ka sa paligid, chine-check mo pa yung ibang tao, andun na nga yung tao. Okay, you have to focus, be responsive to the needs of the person na nilapitan mo. Okay, next is, to be respectful and sensitive. Okay, you have to consider the person's age, okay, the person's gender, cultural background, ayan. So, the reason here is that yung example natin kanina, okay, bago mo siya hawakan, bago mo itap yung shoulder niya, or itap yung lap niya, ayan, you have to consider muna, ilang taon na ba tong taong to? Ano ba yung gender niya? Okay? Lalo na kung ikaw ay lalaki na PFA provider tapos female siya, baka mamaya ma-offend mo siya or mas lalo mo siyang matakot. Okay? Or mas lalo siyang ma-feel uncomfortable. So, pay attention also to your own reactions, no? While talking to the person, you have to maintain an eye contact. Pero wag mo namang titigan. Okay? Wag naman yung nagkikwento siya, nakatitig ka na lang na ganun. Just maintain, pero wag mong glance sa ibang bagay or sa ibang around. Okay, and then balik mo yung mata mo sa kanya, ganyan. Pero make sure that your attention is focusing on the person itself. Okay, so ayan po. Then maintain eye contact. Then practice good communication skills. Okay, then pay attention to verbal and non-verbal communication. So sabi ko nga kanina, hindi lang natin tignan yung mga, or hindi lang natin pakinggan yung mga words na ina-utter ng taong yun. Okay? Also with the non-verbal communication or the non-verbal signs like yung facial expression niya, no? Yung body language niya, yung gestures niya, the tone of his or her voice while talking to you, very important as well. Okay? So next, keep your tone of voice soft and calm. So, kung gaano kalakas, okay, yung boses niya habang nagkwento sa'yo, or gaano kahina, wag mong sabayan. For example, malakas yung boses niya, galit siya, wag mong sabayan. Keep your tone of voice soft and calm. And also, pag ang situation ay traumatic experience or situation, it's very important that the tone of your voice is soft and calm para hindi mag-trigger ng memory. Okay, lalo na kung war zone ang pinanggalingan ng taong yan, no? Traumatic para sa kanya yung malakas na sounds. So, dapat you keep your tone of voice soft and calm. Okay? And make sure that you try to calm yourself first. Okay? Then, next is be honest. Okay? So, you provide only things that you know. Okay? Provide simple and factual information. Be honest. Kung ano lang yung alam mo, yun lang yung sasabihin mo. Huwag kang magsasabi ng mga bagay na hindi ka sure. Okay? Huwag mo sabihin na, okay, andito ako, darating na yung mama mo ha. Okay? Or, okay, a few minutes from now, darating na yung doktor. Okay? Pero hindi ka sure kung merong doktor na darating. Or hindi ka sure kung buhay pa yung mama niya. Okay, or yung nanay niya. So, you have to be honest. Do not use words just to calm the person, pero hindi naman natin sigurado kung totoo o hindi. And then, leave space for silence. So, that's very important. Huwag kang tira ng tira. No? Huwag kang salita ng salita doon. No? Silence is very important to regain the calmness. Okay? To regain the self of the person. So, ayan. Pwedeng merong moment of moment of silence for a while and then saka ka ulit magsalita. Respect privacy. No, you keep the person's story confidential. This is very important, especially that most of the situations are very harsh. No? May mga stressful events na hindi mo pwedeng, or lahat ng mga bagay na ikwento sa'yo, sinabi sa'yo, or nakita mong nangyari, you have to keep it confidential. Now, do not disclose it to other people. No? Pagkatapos nung pag-volunteer mo, bilang PFA provider, baka naman mamaya pag uwi mo, ikwento mo sabay, ay, alam nyo, ganito yung pinuntahan namin doon. Alam nyo, may client ako, may tinulungan ako, ganito yung sitwasyon niya. Tapos, ganito, namatay yung parents niya. Tapos, ni-rape siya. Parang ganun. So, those stories are confidential and it is not ethical for you to do that. You respect the privacy of the person. Okay? Hindi ka pumunta doon para mag-chismis or hindi ka pumunta doon para kumuha ng chismis, no? Pumunta ka doon para tulungan yung tao or lumapit ka sa kanya para tulungan siya, hindi para kunin yung story niya at i-chismis sa ibang tao. So, ayan po. What else? Another principle in active listening is to empathize. Okay, so empathy, okay, very familiar na kayo dyan, is a very common term in counseling and also in therapy, also in classroom management, no? To empathize with other people. So how do you do that? Basically, this is different from sympathizing, no? So when you say empathy, this is the ability, no, to sense other people's emotions. So, ayan, empathize is to, or empathy requires perspective taking. So, everyone knows empathy is very important. No? Ayan, it is often confused with sympathy. Pero ano bang pinagkaiba nitong dalawang to? Okay, so, sympathy involves understanding from your own perspectives. Okay, but remember, you are doing more than feeling sorry for the person. Hindi ka lang dapat feeling sorry dun sa person na naka-experience ng bagay na stressful, pero you have to empathize. No? Empathy involves putting yourself to the situation, okay? Putting yourself to the other person's shoes. Now you have to understand why they may have these particular feelings. So in doing this, you have to recognize your judgments and own biases. So empathic listening is, ayan, sinabi ko dyan, a skill that anybody could improve. Okay, and empathy is, can be emotional, okay, cognitive, and compassionate. So when you say emotional empathy, when you feel something because someone else does. Okay, so this is emotional empathy. You may have noticed, 'di ba, if we are watching drama ng mga teleserye, sometimes you see yourself crying na then that is empathizing, no? Because you are feeling the emotions that the person in the television is feeling also. Parang nararamdaman mo yung sitwasyon niya. Kasi feeling mo, no, nandun ka rin sa sitwasyon na yun. Okay, so cognitive empathy, it involves thinking more than feeling, no? So you put yourselves in someone else's shoes. So when you talk to a friend, for example, about something that is bothering you, you are understood by that person. So pag sinabi mong cognitive, okay, na iisip din niya yung nasa thoughts mo. So, and then compassionate empathy. Okay, so next. Oh, ayan. So, for example, we have here a situation wherein nawala siya. Okay, so how do you empathize with a person experiencing a loss of a loved one? Sige nga. Sige, let's use the chat box for this. Okay, ano yung pwede mong sabihin dun sa taong namatayan? Okay, ano ba yung tama na dapat nating sabihin sa kanya? Okay, sige. We may use our comment section for this. Okay, let's have, okay, your answers. Let's read. Okay, or, ayan, sige. Tama ba na sabihin mong, I know how you feel? Tama bang sabihin mong okay lang yan? No? You need to relax. That's fine. That's okay. Okay? Is it okay to say that? Okay. All right. So here are some sample empathic statements for this situation. So pag may namatayan kang friend, for example, pwede mong sabihin na I can see how difficult this has been for you, no? Or I understand, naiintindihan ko how hard this is for you, no? Alam mo, things are tough right now, no? I understand what is happening is very difficult, very tough, no? But I am here for you. Okay? That is empathizing. Okay? Those are sample empathic statements. Okay? But you don't say, I know how you feel. Okay? Okay? Huwag mong sabing, alam ko yung nararamdaman mo kasi hindi mo alam. No? Huwag mong sabihin, alam mo, okay lang yan. Okay? Lilipas din yan. Okay? You need to relax. Don't say that. Kasi hindi okay yung situation. Linapitan mo nga siya kasi hindi siya okay. Tapos sasabihin mo, okay lang yan. Okay? Mali. 'Di ba? Or, wag mo ring sabihin, that's sad. Okay? What happened is very sad. No? Alam mo, let's not talk about that. No? Let's talk about something else. Okay? 'Di ba? Huwag mo sabihin 'yun, no? Kasi dapat the person should undergo the process of grief. That's normal. That's perfectly fine. What happened or what the person is experiencing is a common reaction to somebody na namatayan. Okay? Or mayroon tayong favorite line dito, no, na alam mo, friend, everything happens for a reason. Huwag mo sabihin 'yun. You might offend the person in the first place. So sabihin mo lang, makiramay ka lang or maki-empathize ka lang, no? I understand what you feel. Alam ko mahirap yung pinagdaraanan mo, naiintindihan ko, no? I can see how difficult this is for you, okay? But know that I am always here. So, ayan. Ipaalam mo sa kanya na you are there to listen. Okay? You are there for him or for her. So, ayan. Okay, so that's an example. So we have here levels of active listening. Ang dami ko nang ipoprovide sa inyong examples kung paano niyo gagawin yung bagay na to, no? Kasi mas maganda yung hindi lang dapat diniscuss ko sa inyo yung mga ibig sabihin ng mga bagay na to, pero it's very important that I also give you some examples that you could use, no, while providing PFA. So you may use clarifying statements like this, no? When you say clarifying statements, it involves checking your understanding about what happened by asking questions of clarifications, no? So yan, pwede mong sabihin, so you mean to say that this and that? So ayan, or tell me if I'm wrong, no? Or it sounds like you mean that. Okay, yan. Okay, or eto, am I right to say, I am right when I say that you, okay, this and that. So, ayan. Okay, or what did you mean by saying, ayan. So, kung mayroon kang hindi masyadong naintindihan, you clarify. Okay, do not assume something. Okay, so ayan. And then, another example is you may reflect, okay? Reflecting feelings. Okay, that's, this level is said to be the deepest type of listening. So reflecting. This involves our ability to interpret what have being said to you, okay, or what might be the person is feeling. Okay, if the person did not specifically identify his or her emotion, no, mag-reflect ka dun sa sinabi niya and mag-reflect ka dun sa emotion niya, no? So pwede mong sabihin, wow, no, that must have been really scary. Okay, so ayan. Okay, or repeating, paraphrasing is also an example, no? Pag ginawa natin to, pwedeng, for example, sinabi ng client mo, no, or sinabi ng tao, I could not make sense of why this has happened to me. Okay, hindi ko maintindihan kung bakit ito nangyari sa buhay ko ngayon. Okay, hindi ko nga maintindihan bakit ganito yung nangyayari, bakit yung ganito yung sitwasyon ko ngayon. Okay? So, dito sa repeating and paraphrasing, pwede mong sabihin, okay, so, I understand it was a confusing time. So, pinaraphrase mo lang. So, hindi mo ginaya yung sinabi niya, pero pinaraphrase mo. Okay? This is ensuring, no, that ensuring the person that you really understood and you are really listening actively dun sa sinasabi niya. And lastly, integrating. So in this context, okay, it means summarizing people's ideas, okay, or responses by highlighting the important things or important points na sinabi niya sa'yo. Okay, so for example, okay, so far you've indicated or you have said that your dissatisfaction with your marriage, no? Kung ang sitwasyon kunwari ay gusto niya lang hiwalayan, no? Yung parent ay yung asawa niya, no, kasi very frustrated na siya. So dissatisfied na siya dun sa marriage. So pwede mong sabihin, nagkwento siya sa iyo, for example, pwede mong sabihin, so far you've indicated that your dissatisfaction with your marriage, no, the pressure that you feel to start a family, no, and your new job, no, each of these things contribute to the stress you feel. Okay, so ayan, sinamarize mo yung mga bagay na sinabi niya sa'yo. Okay, so that's, again, a way of showing that you are listening actively dun sa sinasabi niya sa'yo. And that's very important. No, wag lang yung basta nakikinig ka lang sa kanya. Okay, and these are the things that you should not say, okay, or that you should not do, rather, during PFA. Okay, so ito yung mga bagay na please do not do during the process of PFA. Okay, so don't tell someone else's story, okay? Or do not tell your own story to the person. Okay? Kasi hindi tungkol ito sa'yo. Tungkol ito dun sa taong tinutulungan mo. Okay? Kasi meron tayong mga instances, no? Dahil hindi mo na alam yung sasabihin mo sa kanya, hindi mo na alam kung paano mo siya i-comfort. Sometimes meron tayong instances, no, na nai-insert natin, nakakapag-insert tayo ng story ng ibang tao, no? Yung sinasabi natin, ay, alam mo, pareho kayo ng sitwasyon ni ganito. Okay? Ganito rin yung nangyari sa kanya, tapos ganito yung ginawa niya. Okay? Huwag mong gawin yon. Or, baka mamaya, huwag mo namang sabihin din yung sarili mong story. Na huwag mong sabihin, naku, alam mo, yung nararanasan mo ngayon, naranasan ko rin yan. Okay? Although maganda siyang pakinggan, no? Although, nag-show din siya ng concern dun sa tao, I understand your intention, no? Pag sinabi mo yan, pero mali pa rin, no, na i-insert mo yung sarili mong story dun sa story niya. Okay? Kasi it's it's your feelings, no, your own experiences are different or might be different from the experiences of the person. So maaaring hindi siya makarelate or baka ma-offend siya. Instead na gusto niyang i-tell yung story niya sa'yo, wag na lang. No? Kasi alam mo na pala yung nangyari. Okay? So yan. Then don't give your opinions. Okay? Just listen. Don't label reactions as symptoms or speak in terms of diagnosis, conditions, pathologies, or disorders. Do not label kung ano yung nangyayari sa kanya. Do not assume na siya ay may sakit or siya ay may mental disorder or siya ay nag-undergo ng something na not normal. Okay? Do not diagnose. You are not a psychologist. Remember, you are not a psychiatrist to do that. Okay? So then, don't touch if you are not sure. Nasabi na natin to kanina. Do not interrupt or rush someone else's story. Okay? Huwag mo siyang madaliin kapag nagkikwento siya. Okay? Huwag mong sabihin, o tapos, okay? Okay, ganun yung nangyari. O tapos anong next na nangyari? Okay? After nyan, okay, wag mong gawin yon. Okay, kasi baka ang mangyayari niyan, ma-distract siya. Okay, ayaw na niyang sabihin kasi baka isipin niya nagmamadali ka. Okay, parang gusto mong matapos na yung story niya. Okay, so ayan. Do not speculate or offer possibility or possible inaccurate information. So, yan nasabi ko na rin kanina. Don't take away the person's strength and sense of being able to care for themselves. Okay, so, alam nyo, all people can do it or has the strength to cope. Okay, normally or typically, na huwag mong sabihin sa kanyang, alam mo, kailangan mo ng tulong ko. Okay? Kasi yung dinananas mo ngayon ay bagay na hindi mo kaya. Kailangan mo ng tulong ng iba. Okay? So, wag mong kunin yung sense of being able to take care of themselves. Kasi kaya nila yan. You just guide them to do that. Right? Then, don't give false promises or false reassurances. Okay? So, ayan, nasabi ko na rin kanina, huwag kang mag-promise na darating yung tulong kung hindi ka sigurado. Okay? Or wag kang mag-promise na bibigyan mo siya ng ganitong tulong kung hindi ka sure kung may bibigay mo or may provide mo yun sa kanya. Right? Then, next. Okay, so lastly is to link. So in linking, no, it is to help them cope or encourage positive coping strategies. No? You teach them the value of self-care. So in here, in helping a person, it is always our goal, no, to empower that person to do their self-care plan or to cope. Okay? So katulad ng sinabi natin earlier, no, yun, dapat ang goal natin is to guide them na maging stable ulit. Okay, remember that coping can result into two um, manifestations. It could be adaptive coping or maladaptive coping. Okay, so ayan. Okay, so but okay, if the person cannot do it alone or if the person cannot cope alone, you may offer another resource if they are unable to do it. Okay, so because there are really instances that this happens, no, wherein they cannot. Okay, so take action to help. Okay, by finding access to information or provide access to information. Okay, pwedeng kailangan niya ng something na um, update sa kanya about sa nangyari. Okay? And then next is to connect them with their social support system. You might help them contact their family or their social support system. So this includes their family members, their friends, no, or sometimes religious organization, no. May mga tao kasi na very important sa kanila yung kanilang religious community. So maybe you could help them approach a pastor or help them approach somebody na nasa religious community nila. Okay, so and then lastly, obtain services and other help. Okay, so this is about facilitating access to other support and services as needed. So in here po, no, we also must consider, no, and determine our own limits, no, in terms of what help can we provide, okay, and what help can we not provide. So make appropriate referrals, no, when additional expertise is needed. Okay, especially if this is requested by the survivor. Okay, so, ayan. Dapat alam mo kung kanino mo sila pwedeng i-refer. Okay? Dapat meron kang mga information, updated contacts, and linkages to different psychologists, doctors, and other professionals that might help you in helping the person as well. Okay? And lastly, okay, and very important, okay, medyo naglalag yung ating presentation. Anyway, okay, so the question is, do you feel confident right now that you can now provide PFA to other people? Yes or no? Okay na ba? Confident ka na ngayon? Okay? If that's the case, okay, you start and end, okay, with care for yourselves. Again, okay, kapag alam mong ready ka na, kaya mo nang mag-provide, sige, you have to start looking first your self-care plan, gaya ng sinabi ko kanina. And then right after providing PFA, you also have to know how to end it correctly and appropriately by going back to your self-care plan. When you are helping people, no, or when your helping role, no, in the crisis or situations is over, now be sure to take time to unwind, okay, or to take time for a rest and reflection. No? Okay, so you may also talk, no, about your experience with a supervisor or to somebody whom you trust really well, no? So ayan, be responsible to yourself and others by paying attention to your self-care and of course a daily basis, right? So in here, I can also show you. Okay, some of the helpful techniques, no, during PFA or after PFA pala, no, kapag bumabalik ka na dun sa self-care plan mo. Ito, deep breathing exercise, mindfulness, or pwede mo rin naman tong gawin itong mga bagay na to during PFA. If you are providing people with PFA, pwede mo rin gawin itong mga helpful techniques na to para ma-calm yung person and ayan, ma-feel ng person yung comfort na dapat meron siya habang siya ay nasa tabi mo. Okay, so ayan. And then, ito rin yung mga bagay na pwede mong gawin right after providing PFA to people para ma-regain mo ulit yung stable state of mind and being mo, well-being. Okay? So I want to end my discussion with this simple takeaway. Okay, so here, PFA or psychological first aid is something we love, okay, and enjoy doing, and not something we feel forced to do. So dapat, if you think you could provide PFA, you have to make sure that you will love this profession, okay, you will love this advocacy, and you will enjoy doing this. Okay? And hindi dapat something na napilitan ka lang na gawin ito dahil sinabi sa'yo or hinila kang mag-volunteer. Okay? Or napilitan ka lang kasi no choice na ikaw lang yung taong nandoon na dapat tumulong dun sa tao. Do not do that. Okay? So, this must be something that you will love and enjoy doing so that eventually we will successfully help the person or help another person regain their mental health. Okay, so thank you so much, everyone. Thank you so much for joining us in our last day, okay, last learning session for our celebration of the National Mental Health Month. I hope you have learned a lot from this webinar sessions. I'll see you once again I'll see you again to other learning sessions that will be conducted by the Guidance and Testing Unit soon. So thank you so much. Have a great day ahead, everyone.